Is compounded semaglutide safe or just sketchy? This is a hot topic right now, and I'm getting a lot of questions from my own patients and seeing a lot of confusion on social media. I want to give you the facts so you can make an informed decision on if this medication might be right for you. Hi, I'm Dr. Jennifer McKenzie. I am board certified in family medicine as well as obesity medicine. I own my own practice and I prescribe weight loss medications on a daily basis, including medications like Wegovy. I'm going to give you my take on the safety and effectiveness of compounded semaglutide, and at the end, I'm going to give you 5 safety tips if you are considering using a compounded weight loss medication. Semaglutide is a GLP-1 agonist that aids in insulin secretion to lower sugar levels for diabetics and slows gastric emptying to feel fuller longer. This aids in weight loss and the treatment of obesity. Ozempic is FDA approved for diabetes, while Wegovy is FDA approved for obesity management. They both contain the same active ingredient, semaglutide, and they're both patented and owned by the Danish company Novo Nordisk. Currently, no generics exist due to them still being under patent. These meds have gained a lot of popularity because of their effectiveness endorsed on social media, by med spas, and on the news. This increased patient demand and the high cost ranging from $1,000 to $1,600 per month, along with poor insurance coverage, has led to this medication shortage and decreased access to these medications overall for patients. Patients are seeking cheaper, more accessible versions of the medication, mostly in the form of compounded formulas made by compounding pharmacies. So, what is a compounding pharmacy? These are pharmacies that use active ingredients and tinker with them to meet a specific patient need. They often combine 2 or more medications or take out a dye or other allergen to allow for patient use. Think about turning a pill into a liquid formula for somebody who can't swallow pills or something of that nature. It's important to note that compounded formulations are not FDA approved and are not tested for safety or effectiveness. In order for compounding pharmacies to make compounded versions legally, they need to meet certain criteria. They need to be manufactured in an FDA-registered facility. They need to be on a drug shortage list, so currently Ozempic and Wegovy are on that shortage list. They need to be made for a specific patient, not in large quantities or on a mass production scale. And other alternatives currently don't exist to be used instead. This leads us to ask what happens when this medication is no longer on the FDA shortage list. Will patients be able to continue with their compounded formula? Remember, if you stop taking these medications, people often gain their weight back. These are made for long-term use, not short-term use. Besides the fact that these medications are not tested and approved by the FDA, other safety concerns exist. Novo Nordisk and the FDA have both put out warnings about compounding pharmacies using semaglutide sodium or acetate, which is only for research use and not made for human consumption. There have been increased side effects and decreased effectiveness reported with these formulas. This has led to Novo Nordisk taking legal action against several compounding pharmacies, clinics, and med spas for selling or manufacturing unauthorized knockoffs of their meds. This not only puts patients at risk, but gives them a false sense of security by associating it with FDA-approved medications like Wegovy or Ozempic. So, because of the lack of safety, oversight, testing, and quality assurances of these products, I do not personally prescribe them or recommend them to my patients. I only prescribe the FDA-approved brand name meds such as Wegovy and Ozempic. If you're still considering a compounded formulation, abide by these 5 safety tips to decrease your risks overall. 1. Get a prescription from a licensed healthcare provider. If you don't need a prescription in a clinic or online, it's not legit. Compounded or otherwise, these are prescription-only meds. 2. Avoid pill mills. Avoid a quick prescription either in person or online. If the prescriber doesn't take time to ask about your family and personal history, review the medication and all of its side effects, if they don't offer to discuss lifestyle modifications like nutrition and exercise, then you should find a provider who takes the time to do this for best outcomes. 3. Verify what pharmacy your prescriber is actually using. The pharmacy should be registered with the FDA and the state. Check out Be Safe RX campaign by the FDA to find this information. If it's not listed, then it's not legit. If you're getting an injection in a clinic, you should ask to verify on the bottle itself that it's not semaglutide acetate or sodium, as these are not made for human use. Number 4, don't use compounded formulations if you have diabetes. Diabetics have complex histories, and can have life-threatening complications if not treated properly. If your medication is on back order, talk to your PCP about switching to an alternative med. There are many medications for diabetes that are not on the shortage list. These medications don't have the oversight and quality assurances that a diabetic needs to avoid undue risks. 5. Find a board-certified provider. This could be an endocrinologist or another provider certified by the American Board of Obesity Medicine. You can search the abom.org to find a specialist in your area. These professionals have specific training in metabolism, nutrition, exercise, the risks and safety of these medications. They can safely help you through your weight loss journey. Any provider can prescribe these medications, but it doesn't mean that they should. So ask your healthcare provider if this medication is right for you. Ask about other medications that might be alternatives that are not on the shortage list and are currently available. And if you keep an eye out for my next video, I'll talk more about FDA-approved medications for the treatment of obesity. Thanks for watching, and as always, take care of yourself and take care of your health.